Hi, I'm Dr. Sarah Wassbauer. I'm going to talk to you today about photobiomodulation and whether you can use this low-level light therapy to give hope to your patients. I have no conflicts of interest to disclose. Let's talk about this. So half of you out there want to hope that this works, but maybe you just don't know exactly how because we want to have something to give to our patients. And the other half of you probably think that this is like the snake oil that I found on the shelf in Dubai, and it's just, it's something that you'd find in an in-flight magazine that doesn't really work. It's just a gimmick. Well, we know that photobiomodulation works. Light obviously affects tissues. There's lots of other examples in medicine. And 670 nanometers of light will probably have a photoreceptor in the tissue that's cytochrome C oxidase, and that's in the hair follicle. And what it does is 670 nanometers upregulates this enzyme, and it causes more things to happen in the hair follicle. It lowers inflammation, it seems to speed healing, increases blood flow, it releases growth factors, and it upregulates the energy production, the ATP, of the hair follicle. And we have all this data that hair will grow if you're exposing it to the right light. So what's the problem then? Well, there's a lot of problems. Unfortunately, here's my top 10 list of the current problems of using photobiomodulation for hair growth. Number one, optical window. There's a lot of different tissues that respond to light, but they all respond to different wavelengths of light. So for the scalp, you have to focus on a certain optical window, and there's several, unfortunately. One 668 to 684, that seems to be the one that's most studied. Also 830, that seems to be more vasodilatory, increasing the blood supply. And also in the 450s, there's new wavelengths coming out all the time. That one's in the UV range, but maybe that one will help us grow some light. And problem number two is the therapeutic window. There's only a certain area in which you can get the biologic effect. So interaction seems to be dose dependent up to a point. If you have light being exposed to tissue, if it's right down here, you're not going to get an effect. If it's up here, you're going to get an effect. But then too much is a good thing. Pretty soon you're going to drop off and you're going to get an inhibitory effect. So interaction is dose dependent up to a point, but each dose builds on the previous effect. So here you're going to end up, if you use it too often, you're going to end up in the suppressive effects territory, and what you want is just to stay in the stimulating effects territory, which is probably between 1 and 3 days. So too much is inhibitory, and what we want is cell proliferation. So cell proliferation, which is growth of hair, is optimized with low doses over longer periods of time. So that's what we're trying to do. Problems number 3 through 6 are all physics. The inverse square law, you double the distance, you quarter the amount of energy you're going to get. Lambert's cosine law, if you have anything that's not perpendicular, you're going to get less of a dose sent to your tissue. The bleaching effect, you can't just flashlight at a tissue. It actually has to be on it for a certain amount of time, in this case between 14 or 20 minutes, before it actually gets down to where you want it. And LEDs and other light sources like lasers actually have performance issues. Sometimes with using a laser, the hotter it gets, the less output you have. So you have different output at 5 minutes than you did at 1 minute. So the dosing is changing. Problem number 7 is that distant light is actually different. Distant light actually has a different interaction with the tissue. It's going to make a more diffuse, wider cone of influence than it will if you have direct contact and your light actually penetrates a little bit deeper. So it has to be on the surface of the target, because light can be scattered, absorbed, transmitted, or reflected. So you have to have it very close, otherwise it's not going to interact with your tissue. Different light sources will actually get through the hair, but patient hair length is quite an issue, because any amount of hair, even 2 millimeters, is going to reduce your transmission of light between 32 and 37%. You're only going to be giving your patient, 2/3 of the dose that they need. Now, people have tried to get around this by using lasers, which hopefully get through the hair, and by having people wet the hair or part it with tines, but unfortunately that hasn't gotten us as far as we need it to. Another problem is that hair color, especially around the world, lots of people have dark colored hair. So dark colored hair is going to absorb that light and it's going to be bad for getting that light to the scalp where it needs to be. The final problem is dosing. Optimal dosing would be in the correct wavelength. Optimal dosing would have the correct frequency, and it would be calculated as power density, which is joules per square centimeter. Well, unfortunately, and this is graph from LaserCap, and it's showing that we're only between 3 and 3.5% even on some of their devices, where what we need to be is probably more like this, somewhere in the 20 to 30 range, and it's not yet achieved. So unfortunately, even though we really want to get here, We haven't been able to find a way to do that yet. So in summary, the optimal device does not yet exist, but you can use photobiomodulation now, and there's science to support it. It'll help with wound healing postoperatively. Look for wavelengths in the 668 to 684 range for now. We don't know whether additional nanometers wavelengths will help. Use it frequently, but not too frequently, and get your power density in the optimal range. Start early. The best patients seem to start early. It's dose dependent, so more is better up to a point, and avoid anything with a heat producing element. Thanks very much.